Hey mamas, Nurse Lana here. Today we're going to talk about 3 things no one's telling you about giving birth vaginally and how to be ready for it. So it's almost time to welcome your little one into the world. You can't wait to see that cute face, count all those toes and fingers. But what really happens right after baby is born? I'm here to give you a little insight on what's going to be coming. A little disclaimer, every hospital is different, every team is different. But I can give you at least a glimpse of what might happen. As soon as baby is born, the team will make sure that the baby is breathing and doing okay. If baby is fine, baby should go straight to your belly or your chest as far as the umbilical cord will let it reach. Remember, your baby is still attached to your placenta, which is inside you at this point. Baby will be right there. They will rub, dry, make sure baby is crying, and then right now the practice is usually to give about a minute of that cord pulsating, and then they will clamp the cord, let dad or whoever wants to cut the cord, bring baby closer to you. Now you get to enjoy that baby, look at its cute face, count all the toes and fingers, and while you're doing that, the doctor will be massaging your fundus, which is the top of your uterus, and maybe tugging a tiny bit lightly on that cord and just waiting for the placenta to detach and to come out. The doctor will let you know as soon as it's time to push for that placenta to come out. And that one is a lot easier than baby. Once the placenta is out, the healthcare provider will assess the vaginal canal, the perineum, to see if there are any tears that need to be repaired. If they need to be repaired, this is when they will do it. If you don't have any epidural, they will numb the area before they stitch you up. Then you will have a period of recovery. Recovery usually lasts 1 to 2 hours, and the nurses will check your vital signs about every 15 minutes, and they will continue to push on your fundus, which is the top of your uterus, to make sure it's staying nice and firm, and checking your blood pressure, your respirations, pulse, all that good stuff. Fundal massage. Sounds nice, huh? A nice massage. Well, unfortunately, it's not that nice. The fundus, like I said, is the top of your uterus, and the nurses will massage that, cup their hands over it, and massage it down to stimulate those muscles in your uterus to contract. Your uterus is usually very, very tiny, and we can't even feel it or find it. But it has grown and stretched because your baby was in there. Now the baby's gone, we got to get that muscle to get back to its original small size. So to do that, we're going to stimulate it with massaging. Massaging, again, causes it to kind of cramp up, and you will feel cramping, which is a good thing. It means your body is healing and doing the right thing. Your muscle is tightening up like it should so that you don't bleed out, okay? If your muscle doesn't tighten up, it gets what we call boggy, bleeding starts to happen. So at first, we will need to do pretty strong massages to get any blood clots or excess blood that's inside the uterus out so that it can clamp down and stay nice and firm and tight. After the recovery, the 2 hours, if your uterus is staying firm, every time we check, we don't need to do it as firmly anymore. Then it'll probably just be either every 4 hours or once a shift, depending on the hospital. When the nurses are doing that fundal massage, it helps if you take a deep breath in, and then when they're about to push down, just breathe out with that pushing, with the pushing and with the pain. And sometimes it helps to hold on to the side rails and just squeeze that. Try not to grab the nurse's hand and yank it away. Even though it doesn't feel good, it is necessary to help keep you safe and keep you from bleeding out. The third thing that a lot of women worry about or complain that nobody told them about is the bathroom routine. So again, every hospital has its own policies. Everything is a little different depending on where you are. But generally, about 4 hours after you give birth, you will be expected to get up and pee and empty your bladder. We don't want it getting too full. If that bladder gets too full, it pushes that uterus out of place and keeps it from being able to clamp down and tighten up, and you start bleeding again. So we need to keep that bladder nice and empty every few hours. If you had an epidural, don't worry. Your nurse will make sure that your legs are nice and strong and you can stand on them and walk before you make your way to the bathroom. Once you go to the bathroom, pay attention. Your nurse will teach you the routine that you will be doing for the next few weeks, probably at least a week or two, every time you go to the bathroom. This routine usually involves a peri bottle, which is like a plastic water bottle with a little tip that you can squirt. It'll involve pads, of course, ice packs, sometimes dermoplast spray, which is a numbing spray, and tucks, which are these witch hazel pads. They are medicated pads that are nice and cool and also help in your healing process. Oh, and we can't forget that lovely mesh underwear. So your routine will start by getting one of these lovely mesh underwears. Then you will have a nice big pad on there. If you don't have a big pad, you can use 3 or 4 and kind of stick them together and make a nice big pad, just so you know. Then on top of that pad, you can choose, if you like the ice, you can then have an ice pack. At home, if you don't have the right ice pack, something that could be really helpful is just get a diaper from your baby. Open it up, put some water on it, get it a little wet, put it in the freezer, let it become ice, and then put that on. The diaper is really great because as the ice melts, the diaper just catches it, and your bleeding also gets absorbed by it, so you don't make a big mess. If you're using an ice pack, or if you're using the trick with the diaper, you will layer the tucks on top of that. This is usually what they look like, at least in the hospital. They come in these little boxes. They're nice and thin and round. This is actually more than one. They're so thin. You want to layer them kind of like this. I usually do 3 of them on top of the ice pack. If you don't like the ice pack, just do it on top of the pad itself. Do 3 of these, and you're actually going to leave them on there. Put the pad on with the underwear holding everything, and this just stays right up against your perineum, your rectum, all that area, and it's going to help on your healing process. So there you have it. That will be your routine. Mesh underwear, pad, ice pack, tucks, and the dermoplast spray if you have it. Oh, and don't forget your peri bottle. Once you finish your routine, enjoy that relief. I do hope this video was helpful and set your mind at ease a little bit for what to expect when you have your baby. Don't forget to like and subscribe and share so that we can help more moms. Nurse Lana sending love to all you mamas.